have a good group here in front of us. So I was looking at Sherry, Ms. Moore, and making sure she's ready to roll.
Yep, I'm just trying to see which council members are here. I have so many people here.
I do not see Ms. Prince. Otherwise, I think we have a full vote.
Okay, great.
All right, spectacular. The St. Paul City Council will come to order. Roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Here.
Jalali.
Here.
Naker.
Here.
Council President Brenmon.
Here.
7 present, no one absent.
Before we get started, please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Consent agenda items 4 through 21 are before you for your consideration.
I understand that items 12 and 11 should be taken separately. Is there anything else on consent that should be considered separate? All right, hearing none, Ms. Jalali moves consent. Roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Naker.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The consent agenda is adopted as amended. We'll take item 12 first. Resolution 21-324, approving a lease agreement between the city and the Board of Water Commissioners to lease a portion of board-owned property at 750 Snelling Avenue South for use by the city's Park and Recreation Department.
Ms. Yang is the author of this item. Ms. Yang, we changed the order items 12 and 11 because when an item is withdrawn, there's no discussion on the item. So would you like me to turn this over to you or just explain what we're doing?
Thank you. You can just explain it.
Okay. All right. So item number 12, we're seeking a layover to April 7th. Is that the correct date? I'm looking.
Yes.
April 7th. A layover to April 7th. This is in concert with item number 11. Whoops. I'm hearing a lot of background noise. I don't know. Okay. Item number 12 and item number 11 are connected, and they're items that are coming through the St. Paul Water Board. But item number 11 was entered as a resolution, not a resolution public hearing. And we do need to have a public hearing on this item. So as we discussed earlier in HRA today, item 11 will be withdrawn and re-entered as a resolution public hearing so we can have that procedural step. And we will hear item number 12 on April 7th in tandem with item 11 because the two are related. So Ms. Yang will move to lay over item number 12 to April 7th. The intention to hear it with a new version of item 11 also on that date. So Ms. Yang moves layover. Any discussion on that motion? All right, seeing none, roll call.
Prince.
Aye.
Tao.
Aye.
Tolbert.
Yes.
Yang.
Aye.
Jalali.
Aye.
Naker.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The resolution is laid over to April 7th. And item 11 has been withdrawn. Item 22, Resolution 21-321, authorizing the Department of Parks and Recreation to rename Lewis Park to Roy Wilkins Park.
Mr. Tao.
Thank you, Council President. Can I get a staff report on this? Thank you.
Yes. There are staff available here to do a staff report, I believe.
Yes, Council President Brenmo and Council members Mike Hom, Director of Parks and Recreation. Can folks hear me?
Yep.
Excellent. It's really my privilege here to be before the council and provide a report on this proposal and resolution to rename the current Lewis Park to be Roy Wilkins Park. This is a proposal that was born and cultivated by the community. If we were in council chambers right now, we'd be able to look out and wave to the folks that made this possible. But I do know that they're watching. So I want to take a second to acknowledge the work of the District 6 Community Council Board Chair Karen Groening, their Executive Director Carrie Antrim, and community member Ethan Olston that have brought us to this point. A lot of us are familiar with the contributions of Roy Wilkins in local and national civil rights issues. What I learned and what we learned through this process is that Mr. Wilkins' home in his formative years was adjacent to the current Lewis Park, and that Mr. Wilkins attended school at a site that was raised and now what is part of Lewis Park. We also learned that when Lewis Park was established, it was effectively named for the real estate developer that was developing the surrounding properties and made a portion of the land, which some of it is still Lewis Park, available for park development. That all changed over time, and the shape of the park and the shape of the city has changed a little bit. And what the community proposed and we reviewed and refined is that the park be renamed in honor of recognizing Mr. Wilkins. It also contemplates that we express that history as well as the history of Lewis Park as part of signage and interpretation on site, kind of reclaiming all of that history as part of what we do in community out there. The Parks Department and our Parks and Recreation Commission has established criteria for naming. This proposal and how it has emerged meets that criteria very specifically in the category for historical context and historical recognition. And the Parks and Recreation Commission has reviewed this proposal and unanimously recommended approval. I also want to note a kind of a cool intersection of this proposal with the new community process and proposal for CIB community ideas that come forward that this council supported, and the projects that were selected for CEPTED benefits last year. So because of that, this project will also have a grant or a CIB award to do some related work, including lighting, seating, of course, contemplating some new signage as well as part of that CEPTED project and CIB project. So with that, I want to thank the council for this opportunity. I'd also, again, like to thank our partners at District 6 for helping us get here, and I will stand for any questions.
Thank you. Are there any questions for Mr. Hom? Don't see questions. Mr. Tao.
Thank you, President Bremont, and thank you, Director, for your staff report. I don't have a question. I really appreciate the team for putting this together, and I really want to take this opportunity to thank the North End Neighborhood Organization staff, its board members, to bring this request forward to rename Lewis Park. In their request to the Parks Department and the Park Commission, they recognize that alongside the historic Rondo neighborhood, the North End was also one of the few neighborhoods in St. Paul that had substantial African-American population in the early 20th century. For example, the nearby fire station 22 at 293 Front Avenue had an all African-American crew and was led by the city's first African-American fire captain, William R. Goddard. And one of the African-American family in the neighborhood included Roy Wilkins, his uncles, Sam Williams. And Roy Wilkins lived with his uncle's home 1 block west of Lewis Park on Gaultier Street and attended John Whittier Public School on the northern half of the current Lewis Park block. I'm sorry, hold on just a second here. Thank you. I'm sorry for that. However, through the urban renewal in the 1970s, the Williams and the Wilkins home and the Whittier School were demolished for Lewis Park and redevelopment project. Stories such as these are critical for us as a city to recognize and to uplift so that we can honor our past and also recognize the harm that has been done through government renewal programs. Roy Wilkins was a champion for civil rights and the editor for the African American newspaper, the St. Paul Appeal, and served as executive director of the National NAACP. We as a city owe a great deal of doubt and gratitude for the work of Mr. Wilkins and what he did to advance civil rights. And renaming Lewis Park to Roy Wilkins Park, it will ensure the story about the struggle of the civil rights and our local heroes continue to be told. And with that said, I ask my council colleague to join me in approving the rename of Lewis Park to Roy Wilkins Park. Thank you.
Thank you, council member. I am fully supportive and just want to give a special shout out to Ethan Ostin, who I know was really a driver behind this from the North End neighborhood organization and somebody who is committed to seeing this thing through. So just a special shout out to Ethan for his work on this as well. All right, there's a motion in front of us and no further discussion. Roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Council President Brandmoen.
Aye.
7 in favor, no one opposed. The resolution is adopted. Item 23 is an update on COVID-19 vaccination plans by healthcare providers.
Mr. Tolbert, would you like to tee this off?
Sure. First of all, I just want to thank everybody for, we have a few different St. Paul providers here. And what we asked was for folks to come and give us an overview on some of the COVID situation, but most specifically the vaccination going on in the different organizations. I know they have about probably in total between the three groups, 15 to 20 minutes of presentation. The hope was to let everybody present and then we could open it up for questions at the end. And I want to thank everybody. I know there was preparation to get ready to present today, and I appreciate everybody's willingness and enthusiasm to do so. I think it will be very useful for my colleagues as well as the general community in St. Paul. So thank you all for coming before you present.
Thank you, Mr. Tolbert. And for people who are tuning in to our meeting and who aren't regular attendees of our council meetings, we have been using this opportunity with online virtual meetings to use our platform to share important information. And so I appreciate Ward 3's leadership on coordinating this meeting, and this is an ongoing as I said, platform to share as much information as possible. People are, have varied degrees of information available to them, and as many times as we can get the word out, the better. So I think that's important. I'll turn it back over to you, Mr. Tolbert, in 1 second. We have Dr. Kevin Best and Kristen McHenry from Allina here today, and we'll have them talking first. From Health Partners, we have Pam Zeller and James McLean. They'll be talking second, and this is in alphabetical order, by the way, which I fully endorse as Amy Brandmoen. And then mHealth Fairview, Dr. Abe Jacob, Ingrid Johansson, and Andrea Marcos will also be here to present. So Mr. Tolbert, did you have something to add?
Yeah, and I just want to say, I'll start by saying as a T last name, alphabetical I've always had issues with, but I do feel it's helped me during this time as I wait for my turn to get vaccinated. Having a T last name and an alphabetical lunch lines has helped me prepare for this. But I do want to say the purpose of this really is public safety announcement, kind of to use our platform as public safety announcement. And just for my colleagues, we had Laura Anderson here last week, and she presented on public health. The other thing is after we scheduled this, Roy Wilkins was also announced as another vaccination place, and there's other community places that we could have later, but we thought these 3 providers were important to get some information out there too. But it's not the only people providing vaccines, which I'm sure they'll present too. So.
Wonderful, thank you. So why don't we turn things over to Alina?
Yeah, thank you. Just a quick logistical thing. So I do have a little presentation, but I don't see the ability to present. Is that an option, or I'm happy to do it verbally too, if that works better?
If you're looking at the, first of all, who is talking?
I'm sorry, this is Kevin Best.
Okay. Well, first thing we're going to do is we're going to give you a little promotion and change you to a presenter. And so that should change what you're seeing on the top bar.
Yep. Now we should be good. I can handle it from here, I think. Just want to confirm people can see my screen now.
Yes, we can. Thank you.
And I want to reorganize it so I can see you guys again. There we go. All right. So start off, I really appreciate the opportunity to be able to come and talk with you a little bit about where things are at from the vaccination standpoint within Allina. So my name is Kevin Best. I'm a family practice physician by training, and then serving as the interim vice president of medical operations for primary care in Allina and helping out with our vaccination efforts. So just to start off, just wanted to give a little bit of a high level view. You'll see up in the top there that we've kind of separated our operations into what we call mini hubs, which are locations that we're able to get about 100 to 200 vaccines done per day. And then we have what we call our mass hubs, which is a little bit larger operations that are a little bit separated from our regular clinic operations, which allows us to do a little higher volume throughput. You'll see the first 4 locations that are Coon Rapids, Golden Valley, Oakdale, and Burnsville are our mass hubs. And you can see the information there about the number of vaccines we've given so far. Just a quick note on the pop-up clinics for communities. I'll talk a little bit more about those later and how that is helping us to identify any potential diversity inequities that we're identifying as we're seeing the data come in about how we're doing our vaccinations and a tool we created to be able to help address those concerns. So luckily we are able to deliver all of our vaccine in a timely manner. So we are meeting Governor Walz's goals of delivering 100% of our vaccine within 3 to 7 days of it being allocated to us. Just also wanted to highlight on there that typically since the beginning of vaccinations in December, we've been getting about 3,000 to 5,000 doses per week. This week, we're up to 14,000 doses. And just to note that those are first doses. So as we get farther into this, as you know, a lot of these vaccines have 2 doses. So we're doing up a little over 20,000 total doses now this week. So people are really humming, and I just want to give a shout out to our staff who are really working their tails off to be able to deliver these vaccines to the community. So a little bit about our identification process and kind of how we're handling that. At the end of the day, what we wanted to do was make it as seamless and little effort as possible for our patients to be vaccinated. You know, I think we've all seen and read about some of the frustrations some patients are feeling about how they're getting identified and a confusing process. So we wanted to go with the approach of we would identify patients and then proactively reach out to them so that we'd be able to get them set up for their vaccinations. So what we do is we use our electronic medical record to be able to identify patients that would fit the current criteria set by the MDH and through our own internal processes. And then we randomize those patients. And then depending on what allocation of vaccine we're getting from the state, we then proactively reach out to patients by either email, phone, or letter with the instructions about how they then schedule their vaccination appointment. We started with patients 75 and older. We've been able to work all the way through all of those patients and now down to patients that are 65 and older. And as of earlier this week, all Allina patients that are 65 and older have been reached out to in some way or another to be offered a vaccination within Allina. And now with the announcements earlier this week, we're starting to work into the other tiers which honestly get a little bit more complicated because now we're starting to figure in pre-existing conditions and some other complexities to try to get the right people vaccinated as timely as possible. So we're working through getting that done as quickly as possible. Have also been able to offer vaccinations to all of our healthcare employees and also some affiliate groups that we work with closely, and then have partnered with local public health on some essential worker vaccination efforts as well. Just want to take a moment to talk a little bit about what we've been doing from a community outreach and making sure that we're giving fair, equitable, and equal access to the vaccination. So specific to St. Paul, you'll see that Oakdale is one of our biggest hubs, actually. So just outside of St. Paul, obviously. And then the West St. Paul and Bandana Square locations are a couple of our mini hubs. And then also working on some additional outreach that'll be coming up here, you'll see listed lower. One of the biggest approaches that we took from a equity standpoint was really trying to proactively reach out to different communities to understand what their concerns and questions about the vaccine would be, so that we could identify and proactively educate them and help address or alleviate any concerns or questions. But then I think one of the neatest things that we're able to do is be able to really watch the data as it's coming in and then react to that quickly and be nimble to be able to get to communities that maybe aren't that we're noticing aren't vaccinating as quickly as we expect. So we've actually been able to change some of our locations based on that information. And then that's where I mentioned the pop-up hubs or pop-up clinics are kind of more of a mobile approach where we can put them up pretty quickly. A lot of them are on weekends within different communities. And then we'll identify that community ahead of time by zip code, and proactively reach out and also post different information out there so that hopefully people can have an opportunity to schedule a vaccine in those clinics as well. So just some of the suggestions about kind of where to go from here. If you're noticing different populations that are maybe not, that might be getting unintentionally missed or not having equal access, working through the Department of Health, who is working with the Care Delivery Consortium, which you'll probably hear about from the other providers as well, as the ability to really coordinate together to identify gaps or issues. And then the general approach has been, the state helps us with the guidance about who's coming next and who we want to vaccinate next. And then the care delivery systems have kind of been the delivery arm of that. So continuing to work with that group. And then again, continuing to leverage our existing community partnerships to get the word out about those locations and the scheduling information as well. And then just the ability to stay informed. And this is a quickly moving process, as you've even seen this week, right? Information is changing and things are changing. And the ability that we have to be able to reach out to people through Facebook, Twitter, and some of those mechanisms, but then also our website is an area that we can keep up to date as quickly as possible. I will acknowledge that those are all electronic, so we are also working with, again, posting different signs and different flyers and things like that around the community and strategic places. The other thing we're doing, I mentioned we reach out to patients. If we have patients that are English is not their first language or some other concerns about how we could have reached out to them in the first place, and we find that they don't schedule an appointment, we've got community workers that will actually proactively reach out to them again to see if they had any questions or concerns or difficulty navigating the system. So again, sounds like we're going to keep questions to the end, but I just want to say thank you again for the opportunity to come and present in front of the council today.
Thank you so much. I think if people have questions right now right on your presentation, I think that's fine. And I know we're trying to be efficient, but there is a point where we can be overly efficient. So just quick looking to see if my colleagues have questions. I know we wanted to make sure. Ms. Prince. You may still have your mute on.
Thank you. Thank you, Dr. Best, for your presentation. I'm curious about the St. Paul locations. It looks like Bandana Square is your only St. Paul location, and then your pop-up locations in St. Paul are done with community partners. But you haven't mentioned what the community partners are. And for people watching our meeting today, they will predominantly be people who are looking for information in St. Paul. So I wondered if you could just be a little bit more specific about that.
Yeah, thanks. So West St. Paul is also a mini hub location. So I know not within the city limits of St. Paul. And then again, Oakdale is the other one that's close. Again, yes, I acknowledge that's not in the city limits. We'll definitely take that feedback back and continue to look at that and address it. So I appreciate you pointing that out. But again, yeah, people can still call our main line, and they'll help find a location that's close to them.
Thank you.
Thank you. All right. Thank you so much for this presentation, and maybe we will have general questions for the group at the end. But thanks for kicking us off here today, Doctor. We appreciate the presentation.
You're welcome.
So our next, we are going to Pam Zeller and James McLean. I don't know which one of you is presenting. Oh, or Beth, sorry. There's a lot of people on our call today. Yep. It's hard to know who is presenting. I apologize, Dr. Averbeck.
No problem. Hi, this is Pam Zeller. Can you see my screen?
Yes, we can.
Okay, perfect. So I'm Pam Zeller, Vice President for Specialty Care, and Dr. Beth Averbeck will be presenting with me. She's our Senior Medical Director for Primary Care. We included just a quick slide about who we are as an organization. We are both a health plan and a care system, and we have several different care facilities within the East Metro and in St. Paul, including Regents Hospital. We have several specialty centers as well as primary care clinics. And we also have a research and education arm of our organization and have active research going on right now with vaccine safety, as well as we are an organization that trains students as well. So just a quick background on who we are. Some similarities in terms of how we have approached distributing the vaccine, and Dr. Best shared some really good information. We are participating along with Allina and mHealth Fairview in the 10 Healthcare System Coalition, and I would say this has been a really nice success story of partnership, private and public, and we received comments and feedback from others in the country that they have not seen this level of collaboration, and it's working quite well. Our organization's focus has been similar to Allina's. We are focusing on vaccinating our patients. We define our patient pretty broadly, so it is anyone who has been seen in any part of our organization in the last 36 months, whether that be for routine care, a hospitalization, an emergency department visit, or COVID testing. And we ramped up significant COVID testing over the last year, and so that broadened the reach of those individuals that we would consider to be our patients. We started with 75 and up, dropped the age limit in partnership with the coalition and MDH recommendations, moved to 65 plus this week, and are currently planning on those phase 1B, tier 2 and tier 3 patient categories. We also vaccinated our healthcare workers and partnered to take on unaffiliated healthcare workers as well. And we are using the Vaccine Connector link and sharing that with people who may reach out to us and may not yet be eligible through our organization to help them find vaccine supply in the community. From a distribution perspective, we really set some guiding principles around where we would set up our vaccine sites. So we wanted to have good geographic coverage across the Twin Cities. We also wanted to develop high volume sites so that we could vaccinate as many patients as possible and do that as efficiently as possible. We wanted to make sure that we had sites that were accessible by public transportation, had convenient parking, and were easily accessible within the building, so didn't have to take elevators to reach the vaccine locations. And we wanted to have drive-through locations as well. So you'll see a list of our current locations, and if you're thinking about the East Metro right now, primarily it is Regents Hospital in St. Paul proper. We also have a vaccine clinic in Woodbury, as well as in Lakeview. We just opened up our Bloomington drive-up site last week. And we have additional sites planned as soon as vaccine supply allows. And those additional East Metro sites will include our Neuroscience Center, which is in St. Paul. And we also have a site planned in Maplewood as well. We hit the 100,000 vaccine mark last week and are able to ramp up just as quickly as we can get additional vaccine supply. And like Alina, we are distributing all 3 types of vaccine now within our care group.
Hi, I'm Beth Averbeck. As mentioned before, I'm the medical director for primary care. And I just want to also make a comment that one of the benefits that we have, and I think you're hearing it here tonight, is that all of us on the systems that are presenting also have an opportunity to work with each other separately. So this is really a coordinated effort. So you'll see some very similar themes as we share what we are doing. One of the things that we know from some of the literature and what we've been hearing from our communities is really concern around vaccine safety and how might we address any kind of hesitancy in addition to barriers to getting the vaccine. And what we have is a small group that Pam and I help co-chair, the physician leaders from across our care group that come from diverse communities themselves that are helping advise us on what are they, and they also practice at clinics that have a more racially diverse population. But what are they hearing from their patients? What are some advice they give us as far as how we might work with our patients when we do that proactive outreach? And a couple of themes that we're hearing are patients want to know what's in the vaccine. So going to the safety, 2, have the clinicians themselves gotten it, or do we know people that have had it, and how have they done? And then 3, when the vaccines were studied, what was the percentage of populations from communities of color that were considered in the trials? So I thought I would just mention that we had been involved in the AstraZeneca Oxford vaccine trial that has not yet gone for emergency use authorization. We anticipate that it will. But we had a number of volunteers that enrolled. We were one of the sites that had some of the highest racial diversity. One of the investigators is an African-American physician who grew up in North Minneapolis, and he was really key to helping enroll a racially diverse population in that study. So we are also able to take his learnings and be able to apply it to population as we do proactive outreach to our patients. And then one of the other things we've done is kind of internally, and also this is available for our patients, really highlight our own clinicians and staff that are racially diverse, and they share their own stories about getting vaccinated and why they got vaccinated. And we think that this has been helpful for us as well. And then just to show you kind of our clinic population that have more racially diverse patients, you can see here for St. Paul, our Center for International Health and Midway, they're co-located in University and Dunlop, Lexington area. And then our Health Partners St. Paul Clinic that's located on Wabasha and the kind of Plato area. So those are our 2 main diverse clinics in St. Paul. Maplewood also has got quite a bit of diversity. And then if we look at our broader community, both between Minneapolis and St. Paul, Ramsey, and Hennepin County, you can see our clinics that have between 25 and 39% that are from communities of color. I'll make a comment. I actually volunteered at our Woodbury site, and one of the things that Pam will get into in a little bit that we've done is try and provide transportation for patients that have barriers. And that was one of our first sites before we were able to get the Johnson & Johnson vaccine. So part of what we do is where we are able to do the storage and the safety and do a lot of patients coming through. And I was very pleased to see the diversity that we had at our Woodbury site. Some that were coming with transportation, some that were Metro Mobility, some that came with relatives, some that we had helped provide transportation to.
Okay, so Dr. Averbeck mentioned the committee that we have looking at reducing disparities around vaccine equity. And like Alina, we have really good data coming in to understand where we may see a gap in our patient populations. And so we are trying to respond to that as quickly as we can, and we are making a difference. We started to see that disparity show up in mid-January and formed this team, and through a series of pilots have increased our vaccination rates for patients of color by 120%. So some of the things that we're doing is making sure that we're reaching out to patients using their preferred method of communication. We know that email doesn't work for everyone. We have found that text can be very effective, and we know that we don't have an email or a mobile phone number for some patients, and so we are reaching out using landline phones as well. And we are also sending out some mail through the U.S. Post Office. One pilot that we found to be particularly effective was sending out invitations to get vaccine via text, translated in Spanish, Hmong, and Somali. And we did that based on where we were seeing some gaps in vaccination rates. And that was effective in increasing rates in those patient populations. We've used interpreters quite broadly during outreach and have them available at our vaccine locations as well. And we've done some education sessions with our interpreters, so they are more knowledgeable about the vaccine and around hesitancy and what some of the common questions might be from our patients of color. We have lots of education materials that have been translated. We also are doing telephonic outreach to our patients, and we've created some designated callback numbers for patients we can't reach if we have to leave a voicemail message. So they're able to call back to a phone number that is specific to their preferred language. And we have those phone numbers for Somali, Vietnamese, Spanish, and our Hmong patients. One of the things that we also learned is that our patients of color often need more time to think about their vaccine decision. And with vaccine supply being so limited, our schedules were filling up really quickly with people who were motivated and snatched up those spots. So we needed to set aside some slots or appointments to make sure that people who needed the time to confer with a family member, talk to others in the community, they were able to schedule as well. And we have found that to be effective too. Beth mentioned the assistance with transportation that we've been providing, and we have found that having Saturday vaccine hours has been helpful, as many people need family members to accompany them. From a community partnerships perspective, while we are primarily vaccinating our patients right now within our organization, we are partnering with others in the community to help increase vaccination rates. So we've created an internal clinician speakers bureau to be trusted messengers who are willing to go out into the community and speak to a variety of different groups. And so as a city council, if you have groups that you think it would be helpful to get more information to address vaccine hesitancy, please let us know. We're also exploring partnerships with Ramsey County and other community groups, including faith communities, to see where we can be most helpful. So it not only is just providing education, but we are also trying to provide volunteers to support some of the mobile vaccine clinics or pop-up clinics. I think just in summary, one of the things that we've been trying to do along the way is just keep this simple. And so we are pleased when we get patient feedback that they found the process to be simple. And we are hearing that from many, many of our patients. And this will continue to be an area of focus for us as we move forward. So with that, we would welcome your questions.
Are there specific questions on this section, this presentation? I really do appreciate the focus on the vaccine hesitation. And I think, in COVID, we've all learned so many new words and have been exposed to things in a completely different way. And, I don't think usually anyone is part of the lexicon of vaccine testing our results. And now we're all kind of we think we're experts on it. And the fact of the matter is these vaccines that have been produced in breakneck speed are incredibly effective. But, because we're all in the weeds about it, I think that there's some concerns. There's concerns about how fast it's gone. And speaking for myself, can't wait for that injection. But I definitely think addressing the hesitancy among our communities, and particularly communities of color, is extremely important. So I appreciate the focus on this in this section. Looking to see, looks like Ms. Yang.
Thanks, Council President. I was just going to echo what you said as well. I thought it was really impressive learning about how you all are accommodating different communities, and I think that's like how we can work toward equity and make sure that folks in marginalized communities especially get vaccinated. So I wanted to give you praise for that. Thanks so much for that work.
Thank you.
Thanks, Ms. Yang. Any other questions or comments for Health Partners? All right. Well, thank you so much. We will move on. Keep on moving down the alphabet to M Health Fairview, and I think Naomi is in the house. Is that true?
It is true.
I just started scrolling down, and then I'm like, wait a minute. I know Naomi. It's nice to have you back in City Hall, even though we're not in City Hall. Can I, since I've been doing this to everybody, is it Alem Seged?
Alem Seged, yes.
Alem Seged. Well, welcome, Ms. Alem Seged. It's nice to have you here.
Thank you. And I'll just be sharing my screen and presenting our slides here, and then Abe and Ingrid will be speaking over them. So I'll go ahead and open that.
Great, good to be with you all, and again, proud to be presenting with Allina and Health Partners, because it has been truly a group effort. So I, again, privileged to present with Ingrid, and Naomi has been significant in helping us gather our data and put together this presentation. We can go to the next slide, Naomi. I think it's important to kind of take a step back and refresh where we're at in the pandemic. So this is just the New York Times data from yesterday. And one thing that's important to understand in terms of how we think about vaccination, normally we think about the pandemic is first looking at our new cases, and then seeing a lag in hospitalizations, and then finally seeing deaths. With vaccination, we want to go in the opposite direction. We want to focus on reducing deaths first, hospitalizations, and finally we'll see a reduction in new reported cases, and that's by intent. And again, I think it's important that to note that Minnesota has done a pretty good job at managing this pandemic, but it turns out that ending the pandemic is as hard as managing it, and I'll go over that here in a second. So let's go to the next slide. So this is just obviously all the vaccines, the first three, Pfizer, Moderna, J&J, are currently available through EUA. Here's what's coming. And the University of Minnesota and our health system have been involved in the Novavax trial. And again, kudos to the other health systems, health partners with AstraZeneca, because this is all really important as we end the pandemic and burn out the last embers of this. You see all the data here. It's the other thing to point out is that the issues with cold chain storage and distribution were significant with Pfizer, Moderna, and really impacted how we distribute these vaccines in a safe way. J&J was a game changer because of the way we could store that vaccine safely. It's only one dose, so we didn't have to worry about setting up a second dose. These are all logistical, operational concerns that we've been dealing with every day. The other thing to note, we consider all of these vaccines clinically effective, and I state that, and I want to restate that because you all are significant influencers in terms of messaging to the public, and we've heard this concern about the 66% efficacy. I think it's important to note and is that this is like comparing apples to oranges in terms of when the Johnson & Johnson vaccine was studied in the midst of significant variant prevalence. And so when you look at the data of what prevents hospitalizations and deaths, they're all equally effective. And that's what we're trying to get to, going back to that previous slide. And so we consider these all clinically effective. If you didn't hear me say that once, I'm going to say it again. And so please help us get that message out. If our patients have access to a vaccine, please get the one that's available to them. Let's go to the next slide.
And before you move on, Dr. Jacob, can I interrupt here with a question from Councilmember Tao?
Yes.
Thank you, Council President. Dr. Abraham, can you, is it Dr.
You can call me Abe.
Jacob?
Yeah.
Okay, can you go back to the previous slide? Can you clarify, like for example, the 66% efficacy versus like a 94.5 efficacy?
Yeah, I'm glad you asked because that's the number that people hang on to is why is it so much less effective when they compare it to the other two right next to it. And you really can't compare one to the other because of, again, when the vaccine trials happened with Johnson & Johnson, they were doing it in the midst of variants. The other thing I think to point out is that what we're seeing with these vaccines is it takes a lot of people that would have been hospitalized or died and shifts them down to an asymptomatic or very mild symptom type of disease process, which is great. That's what we want. And so in terms of preventing hospitalizations and deaths, Johnson & Johnson is at nearly 100% effectiveness, at basically day 45, which is, those are fantastic numbers. Does that help answer that question?
Can you also explain why, if we're all we have one virus, but how come we have multiple vaccine? Shouldn't there all just be one vaccine because there's one virus?
Yeah, so the vaccines work by different mechanisms. The first two, Pfizer and Moderna, work through an mRNA technology, which is a new vaccination process, very effective. Johnson & Johnson works through basically using a modified adenovirus, which it gets into the cell and delivers it to the nucleus and then gets it to produce a protein, which then stimulates an antibody response. So it's why we have different vaccines is because they have different mechanisms of action. The first two are pretty similar, a little bit different in terms of how they're stored, but Johnson & Johnson is different in that the way it's delivered basically to the body. But they basically produce the same effect, which is it creates antibody response to the spike protein, which is what we want. And again, to answer your question about the 66%, that includes people who have very moderate, disease, COVID infection that doesn't get them into the hospital. So that's why that number looks lower compared to the other two. And that was in the face of significant variant prevalence in places like Brazil and South Africa, which Moderna and Pfizer weren't studied in South Africa and Brazil.
Thank you.
And I'm imagining, like, just piggybacking on Mr. Tao's question, that part of the reason why there's so many different vaccinations is because of the quick time turnaround that these different laboratories have come up with these, and that probably over time, I'm guessing, and it sounds like you can probably answer this question, that they'll hone in on the one that's, most cost effective to produce, most effective in defending against the virus, et cetera. But right now it's sort of like the scatter shot of all the different laboratories and what they've come up with. Is that correct?
Yeah, everyone was all in. Like, whoever gets it first, great. You're gonna get it out to the market first. But exactly, it was a shotgun approach because we were dealing with a public health emergency, a worldwide public health emergency that everyone wanted to help.
Yeah, and I do agree that over time we'll probably see it narrow down to one or two that are most used, or do you think it will always be sort of a wide scatter shot like this?
I think you're right. I think this will consolidate down to a few vaccines that can evolve the fastest in terms of the response to the variant pressure. But yeah, I don't think we'll have 10 vaccines for COVID out there, 3 years from now. I think it'll become much more narrow.
Right. And when you say evolve, it brought to mind that when we get our flu vaccinations, that they are somewhat varied from year to year, depending on where they think the, what the virus is going to look like in a year. And sometimes they guess right, and sometimes they guess wrong. But you're saying that to be able to evolve to a changing strain of this virus, that would be an adaptable vaccine would be one that would be used.
Exactly. Probably. Yeah, and all three of these vaccines are much more effective than the flu vaccine, just again, for another point of reference. So.
Yeah, I think that's like probably the most important point that gets lost in the shuffle. And kind of what I was saying earlier, it's like, I think if you compare it to the flu vaccine, these are incredibly effective. But we're comparing it to nothing because we've never actually been, most Americans have never been like in the lab, researching vaccines. So I think comparing it to the flu vaccination, which we get and we hope for the best, is a really good, it's worth repeating. So thank you.
Yeah. Why don't we go to the next slide, Naomi? So I just want to again acknowledge that we've been a part of the coalition of the Care System Delivery Coalition with all the health systems in the state. And this has been a really important part of our, basically this group meets every day, trying to understand how best to kind of deliver vaccines safely and effectively. And if we go to the next slide, again, as of today, the New York Times in Minnesota ranks #1 along with North Dakota in terms of percentage of vaccine administered to compared to what we've gotten. So that's a tremendous feat. And again, thanks to all the health systems.
Dr. Jacob, you're muted.
There you go. Can you hear me now?
Yep.
Okay.
Sorry about that.
Yeah, no. mHealth Fairview has administered 140,000 vaccines to date. It's been a tremendous effort. That's all it's been since December 19th. Again, a very short amount of time. We've gotten a lot of vaccines into arms, and we've done this across multiple sites. We have basically sites around the state, up north in Hibbing and Grand Itasca, down to Wyoming and Princeton, and then into the Twin Cities at places like Fridley and Midway, Bloomington, Maple Grove, Woodbury, and Ridges. And we just opened up our interstate site, which is off 280. So administering it all over the place, but we've also set up, we can go to the next slide, our pop-up clinics, which have already been discussed here by our colleagues. Our pop-up clinics have really been focused on those communities where we have minority populations and populations at risk. Here you see the locations where we have pop-up clinics that have already been set up or plan to set up here in the next few weeks. These have been very successful, and our staff have all volunteered on their own time to staff these clinics as they're so committed to this and to their patient populations. And again, really proud of this effort in terms of the pop-up work, if you will, and we'll continue to do this because we know this is a nice targeted way to get to our communities that are highest risk. And there you see a lot of St. Paul locations that we've identified to get into those communities. Let's go to the next slide. We've done a lot of education with frequently asked questions. We've translated this document into several languages. As you can see, we've posted this on our website. We also have the ability to have interpreters both on the phone as well as at many of our pop-up clinics. That's been very intentional. And then here you see, again, similar to Allina and Health Partners, we've been pretty health system agnostic. So you don't have to be a patient of ours to be vaccinated by us. Anyone could go and get registered on MyChart and sign up for a clinic, which is probably the majority of patients. Our patients do it that way, but you can also call our number. And if you have language barriers, work with an interpreter to get scheduled that way as well. And so again, we've been very intentional almost on a daily basis about our vaccine disparity efforts and trying to address that. And I'll go to our next slide. And I'm going to hand it off to my colleague, Ingrid.
Hello, everyone. So I'm Ingrid Johansson, Manager of Clinical Care and Outreach with mHealth Fairview. I'm a nurse by background. And I'm going to talk about our community vaccination work and really our very intentional focus on equity from really the very beginning of this pandemic. We've really developed a 4-track approach to help us describe our COVID vaccination work. And Abe really talked a lot about our system. And I'm going to elaborate on this community-focused work and really narrow in here on, you see, track 1 and track 2. So the public health partnerships with connections to local public health, connecting to providers, and mHealth Fairview Community Advancement, Minnesota Immunization Networking Initiative, or the MINI program. So we have a legacy of reaching diverse communities with vaccines in trusted community spaces, working with trusted messengers, all with the goal of reducing barriers to vaccination. We've been doing this as part of the MINI program for the last 15 years. So serving entire families, working in multiple languages, working all across the metro with community partners to reduce barriers to seasonal influenza vaccination, which like the COVID pandemic, we see disparities for communities of color and uninsured and underinsured communities with uptake of seasonal influenza vaccinations. So we have a a foundation and a history of doing mobile vaccination work in diverse community settings, again, with these trusted community partners, which really gave us a platform to launch quickly and respond with a COVID vaccination. So I have a map. You see a map here of kind of the spread of the mini program over the last several years on that last page. But if you want to, Naomi, would you go back to the first slide that I was on? Thank you. I was just showing, you see a map here of the metro with our community-based vaccination clinics overlapped with community need index scores. So these are neighborhoods with higher burden of health disparities, the darker red, and you can really see how our work very intentionally focuses on communities where this service is beneficial and where people are facing health disparities. And now you can advance it. Thank you. So the model, our 15-year-old mobile flu vaccination program, the mini program, like I said, reaches BIPOC communities and communities facing barriers to vaccination. Those barriers might be language barriers, trust barriers, transportation barriers, cost barriers, not having insurance. And so we have, like I said, this history of working in community. This last flu season, we reached just under 7,000 people at 105 different events, and 89% of those served identified as a member of the BIPOC communities. So this trusted network of community partners, together we were able to kind of transition our model and focus on COVID testing early in the pandemic. We were really pleased to join in partnership with St. Paul Ramsey County. Some wonderful partners there under Kathy Hedin, working with Dr. Ogawa, Laura Anderson, Michelle Van Rankin, Mark Jackson, and Carl Ramirez. And we took this mobile model and helped bring more community partners to the table to increase access to COVID testing in community settings, working with a variety of diverse community partners. And together we held 47 events and conducted over 19,000 tests. So launching this partnership or continuing this partnership, we stopped the COVID testing work right at the end of the year, December 31st, and by January 3rd, together we were able to transition to providing COVID vaccinations. So with St. Paul Ramsey County, we have now to date done 31 vaccination events and delivered over 5,000 vaccinations together. We also spent a lot of time in early January helping to increase capacity of St. Paul Ramsey County Public Health. We did conducted a lot of trainings with St. Paul Ramsey County Public Health nurses, volunteer MRC members, St. Paul Fire paramedics, all to help get them ready to start staffing these large mass vaccination sites that St. Paul Ramsey County Public Health is holding. And then again, together we continue to staff many of these events all throughout the county and in St. Paul. And in early February, we were able to receive our own specific allocations to start doing this work with our mini collaborative partners and our own mHealth Fairview Pfizer vaccine. And so we have now to date provided 13 vaccination clinics and vaccinated over 2,360 people. Again, this is with our community partners that are really strongly representing the Latinx community, the African American community, the Asian American community, and just crunching our numbers really quickly before this presentation, about 68.7% of those we have vaccinated through the mini collaborative identify as BIPOC and 13.9 as uninsured. So again, really working with that community partner to reach individuals disproportionately impacted by this pandemic. Naomi, you can go ahead and go to the next slide. So just wanted to show you some real specific examples of what a mini COVID vaccination clinic looks like and who we're reaching. Here's two examples from very recent events. So we partnered, some of the photographs here are from a clinic that we held in partnership with St. Mary's Health Clinics, which has a legacy of reaching uninsured, predominantly Spanish-speaking community members. And their headquarters is in St. Paul. So together we launched our first mini COVID Vax clinic. We've done several clinics with them now, all in Spanish, with Spanish-speaking vaccinators, Spanish-speaking physicians, and registration staff. All the documentation is in Spanish. You see here one of our staff members who is a physician trained in Mexico, providing screening and answering questions before they come to a vaccinator who's, again, speaking Spanish and able to really answer questions and make people feel comfortable. We also have some data here showing a recent clinic we just did on Friday at St. Columba Church, which is in Frogtown and is a predominantly Vietnamese American faith community, and had a really successful event. About 92% of the individuals we served that day's preferred language is Vietnamese. And you see a picture here of Dai Vu, one of our longtime friends and partners from MDH, helping explain the process to a Vietnamese-speaking elder who was coming in to be served that day at the church. And then just yesterday, we held a large event at Progressive Baptist Church in St. Paul. Again, very diverse. You can see kind of the breakdown here of people's reported race, ethnicity. So 52% identified as Black or African American, 12% Asian, and 10% African. So with using this model, working with these community partners, they're doing all of the outreach to their community members. They understand how to outreach using their language, using these trusted messengers, and getting people signed up. We've heard from a lot of people who've come to our clinics that they felt it was challenging kind of navigating the system, but once their faith community or they heard about it in their temple newsletter, they were able to make an appointment immediately and be served, and in a trusted space, again, working with people who speak their language or look like them and have their questions answered. So this work is we're doing this almost 6 out of 7 days a week, and are really pleased to be able to continue these fabulous partnerships that we've developed over the last 15 years to respond urgently in this pandemic. Naomi, you want to go to the next slide, please? So here's just a visual map for you to see kind of where we're located in St. Paul and Ramsey County. This is just specific to that city and county, but the black dots are our most recent flu vaccination clinics from this last fall, which we felt was pretty critical work when we're talking about trying to suppress respiratory illnesses in the middle of another respiratory pandemic. And then the blue are our COVID testing sites that we engaged in partnership with St. Paul Ramsey County Public Health, as well as MDH. And then the pink dots are our COVID vaccination sites. So you can see we're pretty scattered around the city and have been really busy working in partnership. So that is all.
Fantastic. Thank you. Thank you so much. So just really great, helpful information. I am looking to see if my colleagues have specific questions for you or any of the other presenters here today. Mr. Tolbert.
Yeah, first I just want to thank all of the presenters for coming. This was really helpful, and I think there's a lot of good information out there. My general question would be, is there anything that we can do to help get information out, know about these clinics? How can we use our networks and the people that we're connected to in each of our individual communities? How can we help spread the word so that those who qualify to get vaccinated can get vaccinated when it's their turn?
Yeah, I mean, this is Beth. Maybe I'll speak a little bit. I think each one of our systems are working with how do we outreach to our patients in a way that invites them to come in that are eligible and yet doesn't completely overwhelm the system. So we want to make sure we are able to match vaccine supply with inviting people in. So I think having people, again, what we heard from our communities of color is we need time to learn about the vaccine. So we've been encouraging our clinicians to start talking about it now, even before it's somebody's time, to prepare them. So I think, having questions about the vaccine answered so that when people are invited to, they can come in. And then I think think those public-private partnerships, when we're able to work together in the community for people that might not be patients in our system. So I think that's, our goal is to get everybody vaccinated as fast as we can. And currently the supply, we still have to invite people in or kind of, go through the different categories. So I think the message is it'll be your turn as soon as possible is probably the other message.
And then the other question I have is some of us, like myself, are waiting. We still have probably a month or longer until it's our turn, which I'm totally supportive. I'll get it the second I have an opportunity, but I also appreciate that others should get it first. During this time, is there any public health advice that you give to us in terms of just testing and whatnot? I think people see the light at the end of the tunnel here. At the same time, we're still at a very low percentage of the total population being vaccinated. What would be your general recommendation to the community in the intervening few months here until everybody gets vaccinated?
Yeah, I think what we're going to see in the next 3 to 6 weeks is a significant increase in vaccine supply, and we're going to probably shift from talking about not having enough to actually getting people to get vaccinated. So any messaging the city or public health officials can do about really encouraging vaccination when it's your turn would be really helpful. In the meantime, while you're waiting, it's the same things we've been talking about for the past year. So the importance of wearing a mask. Even our healthcare workers, who are all vaccinated, we're telling them you got to wear a mask because we need to, one, model it, and we still don't know whether you can still be infectious. Until we get to herd immunity, you can still, even though you're vaccinated, there is a risk that you can still have the virus, be asymptomatic, and shed it to a coworker or to a patient. So wearing a mask, doing the social distancing thing. We know the CDC came out with their new guidance this week for those who are vaccinated. It's important to note that for us, it does not apply in healthcare settings. So those who are at high risk are still at high risk. And so we're still being really cautious until we get to herd immunity.
Thank you. Ms. Prince.
Thank you, Council President Brennan, and thanks to all of the healthcare providers here today. This has been great information. I want to thank mHealth Fairview in particular for the trusted messenger approach. Progressive Baptist Church is in my ward, and you were doing testing there earlier this year, and in the fall, and now with the vaccinations. They were calling everybody. They are so well connected within our community, not only to the African American community, but to the whole diversity of people we have living over here on the East Side. And so I think that's a very effective model for getting the word out and encouraging people to take advantage of these opportunities.
Thank you, Ms. Prince. So true. I saw us all nodding along when she was talking about as soon as you get the notice from your temple or from your church bulletin, it's like, oh, okay, I trust my community and this seems like the right thing to do. Looking to my colleagues, any other questions or feedback before we cut our guests free here today? Okay, well, echoing my colleagues' comments, thank you so much for taking the time to share this important information with us, and we will in turn share it out with our social networks and our communities. So thank you so much for being here today.
Thank you.
Thank you for the opportunity.
Councilman, before they leave, could we ask to send over the PowerPoint so that we can have them on this document and share accordingly? There's really good information in there, and I just wouldn't want to lose that.
Yeah, that if the folks who have control of the PowerPoints could send them to us, we can attach them to the public record for this meeting, and so that anybody who's watching this later, or if the reporters are hungrily digesting this information, they can use that as a reference as well. But I think that then puts it into the public record forever, so that would be great. All right, thank you so much.
Thanks.
Thank you.
All Item 20, item 24, final adoption of ordinance 21-4, amending the zoning code as recommended the definition of family zoning study.
All right, and this is before us for final approval, and I'm just looking to colleagues to see if there are final comments before we go to a vote. Ms. Jalali.
Thank you. A little out of habit of talking. I feel like I've been really quiet today so far. Okay, great. Well, I asked some questions about this this definition of family last week because I want to say that I wholeheartedly support advancing this definition. I will be voting in support today. I wanted to acknowledge some points that have come across to our office, given the feedback that we've gotten from some neighbors and area district councils, and a special situation as it exists in Ward 4 that I think is important to address as we move forward with this new definition. So first, I do just want to thank Michael Wade and PED for years and years of work on this important citywide effort. And I believe this is a very significant step towards equity in our community. It's going to modernize and update our definition of family citywide in a way that we desperately need. We saw in very stark and sobering numbers at our HRA presentation earlier today the work we have ahead of us to make sure we can expand the number of homes in our community. And one of the ways we can do that is actually just legalize more types of families in the homes we already have. So I just want to underscore how much that matters and why this is so important today. Our office has heard a lot in the last several weeks about the student housing overlay in the St. Thomas area and how this district would interact with the forthcoming proposed family definition. We've heard extensively from university staff, nearby neighbors, the West Summit Neighborhood Advisory Committee, the Union Park District Council, and area district councils. And we've worked with all those groups and with department staff to ask a lot of questions about how the change would be implemented, given that the definition before us today to vote on would include the student housing overlay within it as approved by the Planning Commission. So my top concern with this was making sure that this is not actually, if it approved as is, an automatic expansion. And I think sorting through that is actually very important to understand and is a really critical factor for me in supporting the definition we have before us today as it relates to the student overlay. We heard from DSI last week and have been sharing information across the community to date that a number of policies dictate actually how many people can live in a given building in our city. And just because we're actually including the student housing overlay within the definition of family as we're updating it today doesn't automatically expand the number of people that can live in a building within the overlay district. The fire code sets several standards for occupancy, including minimum square footage at 200 square feet per resident. The minimum property maintenance standards requirements start at 150 square feet per resident. The state building code sets an occupancy load based on a number of factors, including egress in and out of the home, square footage, habitable rooms, and more. So I just think that it is really important that we make policy based reasonably on codes we already have and the goals we're trying to meet and balance within neighborhoods, and not just speculation about what will or won't happen based on one part of the policy as proposed. And in acknowledging that, I also want to say I do not believe that changing the definition of family and occupancy rules within the student housing overlay won't have any impacts. I reasonably expect to be very engaged on enforcement and monitoring, and I want to speak to that in a minute. But I think it's important to emphasize that a significant part of the basis for my support today is that this change alone doesn't actually override whether more residents are able to live in any single home or building in or out of the district. It is simply expanding what's possible so that we can continue meeting our housing shortage in any part of our community. So toward that end, as we advance this new definition, it's my understanding it goes into effect 30 days from now. So I believe our office should work with DSI to improve enforcement in the neighborhoods surrounding UST so that all the codes are being enforced in their totality. My office is going to explore budgetary options in this cycle in partnership with UST and the neighborhood to make sure we have the resources to enforce every code within the buildings in the overlay district. The idea of a formal review of the policy after a year was raised last week, and I would reiterate my commitment to that. I said last week and continue to believe that's a very sound and I think bare minimum reasonable idea. And my office is also going to begin monitoring as the policy takes effect 30 days from now to have more regular meetings on this issue within the neighborhood. I think in addition to the 1-year review, we can commit to a 6-month checkpoint with the neighborhood and engagement in an ongoing fashion before and after that, meetings with the neighborhood district councils, UST, and neighbors as requested to monitor the new policy in effect. I think that is reasonable and important as we embark on this change. And our council is also going to be reviewing policy soon, like administrative citations that will allow the city to further enforce all our housing standards with uncompliant landlords, including very vulnerable renters in our community that I heard my constituents do care about and want to protect. So based on this research brought forward by staff on the limited estimated impact so far in the neighborhood, the additional codes that are relevant here, what our offices put together is a monitoring plan and a series of commitments, and then the policies in the near future that are going to strengthen our ability to manage this change well as a full council. I am comfortable supporting the new definitions as presented today. And I also ultimately believe that more housing options in the neighborhood are going to address the shortages that we just heard about at the HRA, and we'll continue to advocate for that. I also believe, and it's important to note, the new definition could actually help address the shortages itself. It would allow more students into existing homes where the totality of code supports that versus some limitations that are currently imposed under what we have on the books. And I think at a time when we have incredibly low vacancy rates, continual upward pressure on rents for families across St. Paul, and housing shortages across our community, giving our residents access to additional rooms and space can't be underestimated as long as it fits within all the other health and safety codes our city has. So overall, I wanted to speak to these aspects and commit to and recommit to continuing to ensure this policy is implemented equitably and thoughtfully, including revisiting it at a future date at the checkpoints that we named. I do strongly support the overall changes being passed today to update our definition of family to be significantly more equitable and modern. And I really deeply appreciate, and it was not lost on me, that the many constituents who wrote to our office to emphasize that they want to make sure that this aspect is addressed made it very, very clear that they support these goals too. My office will keep working with these community partners to ensure its intentions are met in all the neighborhoods. And I wanted to make sure I could address these things ahead of our vote today. Thank you.
Thank you, Ms. Jalali. Mr. Tao.
Thank you, Council President. I will be speaking in favor of this. Of all the things that Councilmember Jalali has mentioned on the technical side, I think that as we have adapt and change in society, our definition of family has really changed, and it's really based on our love and our lived experience. And I think that this not only recognize the technicality of fulfilling our the need for housing, but also recognizing that family are changing, and that in my Asian or Hmong culture, you know, family is my kids, myself living with my parents, and then my grandparents might even be living with us, and so that's why I'll be supporting this.
Thank you, Mr. Tao. Are there other comments before we head to a vote? All right, Ms. Yang.
Thanks, Council President. I will also be supporting this as well. And Councilmember Jalali, I just wanted to say it's been really insightful hearing your thoughts, and just like you recapping, your stance on this, knowing that you had a lot of constituents who emailed not just you, but all of us about their experience around student housing. And I wanted to name, like for me personally, that I still remember when I was in college and how difficult it was, especially as like an off-campus student to have to go to a class and then wait in between, but not really have a place to go to. And then student housing was really important. Like I had friends who, were in student housing, and so we had many students who always came in and out of those houses, and often like ended up parking, on the side of the street and really filled those streets. But I feel like it was a really positive experience overall. And wanted to also point out, like, I felt like, some of the comments that came in really were framed in a way to target young people, especially like, young scholars who are going to school, and almost frame them in a really negative way. And I feel like that's, something that definitely needs to be, checked. And I hope that, that narrative will definitely change, because like those folks, I think that the reason why I asked last week, like, hey, how many young people were involved in this, is because I felt like we really were missing the voices of young people who were being talked about with this definition change. And I wanted to also say, I know that one of our district councils in my ward and several others have also expressed like their strong support for completely like removing the definition of family overall in this. Like there's a lot of historical context like rooted in discrimination upon like gender and class in the past. And there's a lot more that I see coming our way in which we can really change and improve the zoning codes here. You know, for the folks who are really leading the effort on that, like I just wanted them to know that, you know, like I personally like really look forward to that and would support that and want to continue that conversation, because I don't think that this conversation, it just ends here with the changes that we are seeing. Like there's a lot more that we could do to really make sure that our zoning codes are, you know, modernized and really reflect what our communities really need.
Ms. Daker.
Thanks, Council President. I applaud and completely agree with everything that's been said so far, and I'm really excited about this opportunity. I think this will bring us the gentle density that we need to grow our city. And just a couple points that I wanted to add to what's been said already. One is I am, just as Ms. Yang just pointed out, I'm very glad that we're replacing the term family with household throughout this ordinance. I don't think it is the city's place to decide what a family is or what a family looks like, and the term household that we're replacing it with now is much more appropriate and much more aligned with our values. And I want to just really thank those district councils who took the time to weigh in on this during a year when there was so much else going on. I got the most thoughtful comments that were submitted in the spirit of welcoming and abundance and concern about discriminatory language and disparate impacts and what this could do to the supply of housing and affordable housing. I think sometimes the natural inclination is to push back against additional density and to be defensive about who's already here rather than who else we want to welcome to join us. And the comments that I saw from the district councils in my ward were exactly the opposite. And I think that was true largely citywide. So just really wanted to thank everyone for weighing in.
Thank you. Are there other comments before we move to a vote? All right. Seeing none, I will take a motion from Ms. Jalali and roll call.
Prince?
Yes.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Naker?
Aye.
Council President Brenman?
Aye.
7 in favor, no one opposed. The ordinance is adopted. Item 25, final adoption of ordinance 21-8, granting the application of 2069 Marshall Avenue LLC to rezone property at 2069 Marshall Avenue from T2 traditional neighborhood to T3 traditional neighborhood and amending chapter 60 of the legislative code pertaining to the zoning map.
And I apologize for not saying this earlier, but I did want to draw attention because we are not having a traditional public hearing in COVID, and I know we're looking forward to those days for the most part very much moving forward, but I do want to make sure that people are know that emails that were sent in on the definition of family, letters, et cetera, and calls that were transcribed and attached to the public record on that previous item. And again, on this item, it fills up a whole page. And so I just wanted to point out that there are a lot of folks took the opportunity to share their perspective on this item. And we do see those. They are attached to the permanent record. So I'm drawing attention to that before we move on to the discussion. So this item 25 is before us for a final vote. And so as we move into a vote, if there's any further discussion or comments on this item. Or questions? All right. Seeing none, Ms. Jalali moves item 25. Any discussion on the motion? Seeing none, roll call. Ms. Prince.
Oh, mute it. I think you're on mute.
You're on mute.
Thank you, Council President Brenmone. I was definitely moved by the volume of testimony against the rezoning. I had hoped that the developer would be more inclined to work with neighbors about some kind of a compromise proposal. So I will be voting against the motion.
Okay, so there's a motion and no further discussion. Roll call.
Wait, so I'm sorry, just to clarify, the motion is to approve and Councilmember Prince was saying voting. Okay, I was like, wait, did the motion change? Okay, thanks. Sorry about that.
So I think it's better to know before we vote.
Yeah, thank you.
Prince?
No.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Naker?
Aye.
Council President Brenmone?
Aye.
6 in favor, 1 opposed, being Councilmember Prince, the ordinance is adopted. Item number 26, final adoption of ordinance 21-10, creating chapter 223 of the legislative code relating to guaranteed income program.
All right, and this too is before us for final adoption. Is there any last comments on this item before we go to a vote? All right, seeing none, I will take a motion from Ms. Yang. Further discussion? Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Naker?
Aye.
Council President Brenmone?
Aye.
7 in favor, no one opposed. The ordinance is adopted. Item 27, Resolution Public Hearing 21-39, authorizing the Police Department to amend the 2021 Special Fund Budget to add the missed 2020 year-end technical amendment.
All right, and this is a public hearing. Testimony has been taken over the phone and online. As such, Mr. Tao moves to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Naker?
Aye.
Council President Brenmone?
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 28, Resolution Public Hearing 21-47, approving the application of Shamrock's Irish Nook for a sound level variance in order to present outdoor amplified music on Wednesday, March 17th, Friday, March 19th, and Saturday, March 20th at 995 7th Street West.
Ms. Naker.
Thanks, Council President. I just wanted to say how great it is to see a sound level variance on our agenda. And I don't know if I thought I would ever say that, but it is wonderful to see Shamrock's bringing the fun back to West 7th Street. And I think we're turning a corner in terms of events and vibrancy. So just wanted to note that.
I noticed it too and was excited to see it on there, and also hoping that they're, even though it's an outdoor event, that they're using precautions. We are not out of the woods yet, but I do feeling the same way, a bit of hope that normalcy is on the horizon. So
my understanding from DSI, by the way, is that they and every applicant that is being granted is. So.
That's great. Okay. Well, thanks for that clarification. Ms. Prince.
And do recall that it was last year on St. Patrick's Day that everything was called off. So it really is meaningful that Shamrock's is the first sound variance we've seen in a year.
All right, so this is
other than for construction.
So this is a public hearing. It's been held online and over the phone. Let's see, online and over the phone. So as such, Ms. Naker moves to close the public hearing and approve. Roll call.
Prince?
Aye.
Tao?
Aye.
Tolbert?
Yes.
Yang?
Aye.
Jalali?
Aye.
Naker?
Aye.
Council President Brenmone?
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 29, Resolution Public Hearing 21-48, amending the financing and spending plans in the fire department in the amount of $14,200 for the 2019 Hazardous Materials Emergency Preparedness Grant.
All right, and this is a public hearing. It's been held online and over the phone transcription, and as such, Mr. Tolbert would move to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 30, Resolution Public Hearing 21-51, approving an amendment to the spending and financing budget for the Ford Site Redevelopment Capital Project and Hidden Falls Connection Project to reflect receipt of the State of Minnesota Point Source Implement Grant for the Ford Site Central Stormwater Utility and related facilities, as well as updated cost estimates and related sources on the Mississippi River Boulevard Crossing Project, also commonly referred to as the Hidden Falls Connection Project.
Mr. Tolbert, did you need a staff report on this item?
I do not.
Right.
A motion to approve. Close the public hearing and approve.
Mr. Tolbert moves to close the public hearing and approve. Any discussion on that motion? Seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 31, Resolution Public Hearing 21-34, approving installation of bike lanes on Hamlin Avenue from Highland Parkway to Randolph Avenue.
Mr. Tolbert.
Yeah, I just want to thank everybody for laying this over last week so that we could look into a few more things. We just checked in on to ensure there wasn't any more additional parking that we could add back into the project, or any other pedestrian improvements that could be added within the very limited mill and overlay budget. And I also wanted the opportunity to talk to a few of the local businesses that reached out last Wednesday, so that we could talk about it. A few things I will say: I think this is a great bike connection. I think this is an added spot that is well needed in our neighborhood. The other thing I will say, and I think one of the best benefits of this is, in addition to the bike path, narrowing what is a wide street and adding the lanes that could slow down traffic. Additionally, there is some pedestrian improvements right around the school, about halfway through the bike lane with a bump out, and that will make it safer for families to cross Hamlin Avenue at that place, because cars do go pretty fast. I will say that some of the local businesses have reached out concerned about the potential loss, about some of the parking changes that will happen as a result of this bike lane. I do think overall, staff did a really good job of minimizing the amount of spots that will be removed or become no parking. The other thing, and I did talk to some of the businesses about this, is there's quite a bit of time-sensitive parking or parking permits right around the business node at the corner of Hamlin and Randolph. And if it could be beneficial to keep cars moving there, I'm open, and I know Public Works would be open to changing the time from 2 hours to a half an hour to an hour, depending on what would be most beneficial, so that people who stop by some of these places have the opportunity to move the cars so the parking spaces open up. But overall, I do think this is a important component, and most importantly, will make this stretch of Hamlin quite a bit safer, not just for bikers, but also for the entire community of pedestrians walking around there. And with that, I would make a motion to close the public hearing and approve if people don't have other comments.
All right, so there's a motion to close the public hearing and approve. Any discussion on that motion? All right, seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker,
Aye.
Council President Brenman.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted. Item 32, Resolution Public Hearing 21-52, approval of the capital improvement plan submitted by the St. Paul Saints, identifying capital improvements to be formed at the ballpark as part of the Saints AAA affiliation with the Minnesota Twins, authorizing the use of capital expenditure funds in an amount not to exceed $275,000 and amending the spending and financing budget in the Lower Town Ballpark Fund.
All right, this is public hearing. Is there a need for a staff report on this item? Okay. Seeing none, Ms. Naker would move to close the public hearing and approve. Roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Naker.
Aye.
Council President Brenman.
Aye.
7 in favor, no one opposed. The public hearing is closed and the resolution is adopted.
Ms. Moore, before we move on, I removed whoever that was from the phone, someone accepted that random phone number in and I just removed them from the call. I don't know who it was. So if we know somebody is trying to call in, that was the noise we could hear on the line. So just so folks are aware, and maybe we don't let them in again. We're not expecting a call from anyone.
Thank you. I did not let them in. The legislative hearing officer recommends adoption of the following resolutions as no objection to these recommendations were received. Item 33, RLHVO 21-7, 928 Arcade Street. Item 34, RLHTA 21-47, 1430 Avon Street North. Item 35, RLH VBR 21-11, 1393 Beach Street. Item 36, RLH OA 21-5, 1544 Beach Street. Item 37, RLH TA 21-18, 2245 Carver Avenue. Item 38, RLH SAO 21-17, 1216 Charles Avenue. Item 39, RLH SAO 21-15, 1496 Charles Avenue. Item 40, RLH TA 21-43, 1042 Churchill Street. Item 42, RLH TA 21-49, 1183 Inglewood Avenue. Item 44, RLH TA 21-41, 1159 Gaultier Street. Item 45, RLH VBR 21-12, 1151 Geranium Avenue East. Item 46, RLH SAO 21-12, 1151 Geranium Avenue East. Item 47, RLH VBR 21-9, 375 Hawthorne Avenue East. Item 48, RLH TA 21-7, 1516 Holton Street. Item 49, RLH FCO 21-18, 354 Hope Street. Item 50, RLH SAO 21-10, 1597 Jackson Street. Item 52, RLH TA 21-42, 1577 Marion Street. Item 53, RLH TA 21-46, 1379 McAfee Street. Item 55, RLH CO 21-1, 38 Mounds Boulevard. Item 56, RLH VBR 21-8, 1216 Rainy Avenue. Item 57, RLH TA 21-150, 250 Syndicate Street South. Item 58, RLH SAO 21-11, 677 Thomas Avenue. Item 59, RLH TA 21-135, 724 Virginia Street. Item 60, RLH VBR 21-10, 963 Watson Avenue. Item 61, RLH TA 21-50, 1110 Woodbridge Street. Item 63, RLH TA 21-151, 903 York Avenue. Item 64, RLH AR 21-12, collection of delinquent garbage bills. Item 65, RLH AR 21-9, also collection of delinquent garbage bills. And the motion is to adopt these items.
All right, so moved by Mr. Tao. Any discussion on that motion? Seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Naker.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearings are closed and the resolutions are adopted. For the following items, no objections to the legislative hearing officer's amended recommendations were received, and therefore she recommends amendment and adoption. Item 43, RLH RR 20-31, 1033 Gaultier Street, and item 51, RLH RR 21-2, 864 Marion Street. And again, the motion is to amend and adopt.
All right, and so moved by Mr. Tao. Any discussion on that motion? Seeing none, roll call.
Prince,
Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali.
Aye.
Naker.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The public hearings are closed and the resolutions are adopted as amended. For the following items, the legislative hearing officer's recommendation is to refer the item to legislative hearing to the corresponding dates that I'll name off. Item 41, RLH TA 21-57, 1252 Earl Street, April 8th. Item 54, RLH RR 21-9, 1816 Minnehaha Avenue East, April 13. And item 62, RLH RR 21-10, 521 York Avenue, April 13th. And the motion is to refer the items to the legislative hearings.
So moved by Ms. Prince. Any discussion on that motion? Seeing none, roll call.
Prince, you don't appear to be on mute.
Councilmember Prince, aye.
I'm mute. Aye.
Tao,
Aye.
Tolbert,
Yes.
Yang,
Aye.
Jalali,
Aye.
Naker.
Aye.
Council President Brenmon.
Aye.
7 in favor, no one opposed. The items are moved to the legislative hearing officer. That's it.
Great. And just in time, my headset literally just died. Ran out of charge. That is a message, isn't it? Any news from the wards or updates before we adjourn today? It's been a marathon. Ms. Yang.
Thank you. I wanted to let everyone know about the Hillcrest community event that we have. We are going to be sharing to the public 2 scenarios that have been drafted for the Hillcrest Golf Course development. It's really exciting. It's going to be an online event on next Tuesday, March 16th at 5:30 p.m. And there is a website on the city link if you would like to register for it in advance to get the Zoom link sent to you.
Thank you. It sounds like your things are dying too. There's like
I hear an echo as well.
Mm-hmm. We're wilting. Thank you very much for that update. Any other, and I can't wait to see it. It's a huge deal for the East Side. So I can't wait to see the plans. Any other news or updates from the wards? All right, lovely. Well, thanks everybody for what a day. It's been great. There's nothing more for us to consider, so we are in adjournment.